Dr. Ferguson walked into the room, looked at her, and I can just remember it. She looked at me and she looked at Margaret and she said to Margaret, "I know you don't feel well and I don't know what's wrong, but I'm going to figure out what it is."
So we first started noticing issues with Margaret late in the fall of 2011. And she started complaining of intermittent leg pain, intermittent shoulder pain.
A lot of the spark had gone out of Margaret. She was sick a lot, she hurt a lot, she was very uncomfortable going to school, just not as happy as she had been.
I couldn't get on socks. I had to have Mom and Dad help me get them on because I couldn't bend over. My hip hurt a lot.
I was really tired of watching my daughter hobble on and off the bus and just, she was in pain getting on the school bus every day. I did a little research and got a hold of Dr. Ferguson's email address and sent her an email and explained Margaret's story to her. So when I got the email back from Dr. Ferguson within a matter of an hour or two of sending it, I think I almost cried. It was so hard to watch Margaret be in the level of pain that she was in, and so to be treated in a way that felt like we were people and not just another number or another patient was really helpful. The first condition that Margaret was diagnosed with was CRMO, which is chronic recurrent multifocal osteomyelitis, which manifests itself as lesions on the bones. Dr. Ferguson wasn't convinced that there wasn't more going on. There were one or two symptoms that just didn't quite gel with that, and there were some results coming back to tests that suggest there was more going on. And so eventually she had an MRA, which showed that she has a very narrow carotid artery, which is consistent with her diagnosis of Takayasu's arteritis, which is a very rare kind of condition. It manifests itself as very narrow branch arteries to the heart, and in Margaret's case, it's her carotid artery.
Margaret's disease, her Takayasu's, my understanding is it's usually 2 to 3 years before that disease is often diagnosed, and Margaret's was diagnosed within a matter of 10 months, which is amazing. I really feel like it saved her from so much damage to her heart and to her life. I think that she lives the life she does because Dr. Ferguson was able to diagnose her condition so quickly.
Margaret is doing wonderfully. As she really, I think, sort of forgets some days that she has her conditions because she's not living with pain anymore on a regular basis. She's not living with discomfort. She can go about her life like a normal 13-year-old.
Margaret used to say that we were her heroes, and now I think she would say Dr. Ferguson was her hero. I think we would say Dr. Ferguson was all of our heroes.
I've sort of discovered that it's okay to have something like this going on, that it's going to be a part of life. I feel like it's going to be an easier road now. I feel happy a lot more often now.
I think the future holds wonderful things for Margaret. She can do anything that she wants because she has been given the gift of her life by the Children's Hospital. I would love to say thank you for giving my daughter every possibility for the most wonderful and bright future, because I really do believe you gave it to her.